Welcome to Health Talk. Today we're going to talk about what is high blood pressure. With us today we have Dr. Mary Rithuvarki, Olivia Whiting, Shannon Liu. So there have been some changes about what is defined as blood pressure and what is high blood pressure. So tell us the new findings.
Yeah, that's right, Dr. Wu. There has been a change recently in 2017. It's called the Joint National Committee, where both the ACC, the American College of Cardiology, and the American Heart Association, they have revised the guidelines for what high blood pressure is. Previously, we used to think 140/90 was high blood pressure, but
so 140 systolic, the top number, and the bottom number 90.
But now less than 120/90 is considered as being normal, and anything above 120/80 is considered to be on the higher side of blood pressure. So the guidelines go like this: less than 120 the top number and less than 80 the bottom number is normal, which is being normal. And there is something called as elevated, where the top number goes from 120 to 129 and the bottom number being less than 80. And then there's stage 1, where the top number goes from 130 to 139 and the bottom number goes from 80 to 89. And stage 4 is called classic high blood pressure, which is stage 2, which is more than 140, the top number, and the bottom number being more than 90.
So what previously was thought to be 140/90 is now stage 2.
Stage 2.
Yeah, so that means you have it. So in changing it for the top number less than 120 and the bottom number less than 80, that means 100 million more Americans have high blood pressure. So that means we have like 34% of the U.S. population as having hypertension. So that's the latest news. And that means that go see your primary care doctor immediately or check it yourself. There have been lots of issues about high blood pressure, mobile apps, what to do about it, and the definition of it. And as I understand, both of you are involved in a study about high blood pressure. And tell us a little bit about that, Olivia.
Yeah, we conducted a study. There are about 700 participants. We went around taking demographic information, gender, where the people were from, and we found out that actually Shannon knows a little bit more about the beginning of the methods of the survey, so I'll let her talk a little bit more about that.
So we asked questions like, what is high blood pressure? And we found that only 14% of the 700 knew that high blood pressure is at least 120/80. And what other questions did we ask?
Yeah, we asked several other questions about whether or not that person had high blood pressure, how they were monitoring it, were they taking their blood pressure at home, were they using any mobile apps to manage that, and so we found some interesting results,
The reason why we asked about mobile apps is because more and more people are starting to rely on mobile apps to monitor their blood pressure. So we looked at the top 15 most downloaded mobile apps for hypertension, and we looked whether or not they indicated that normal was below 120/80, and they all had hypertension logs, but only 3 of the 15 had indications of normal blood pressure range. And we
nobody said on the apps there's no disclosure saying, by the way, normal is.
Yeah,
right.
So they don't have anything to compare their blood pressure to. They don't know if they're deviating or not. And we also look to see if those apps included factors you can monitor to reduce your blood pressure. So those factors include like alcohol consumption, exercise, BMI, sodium intake, and what did we find for the results?
We found for that really, out of the 15 apps that we analyzed, there was no app that was inclusive of all of these other factors that are such high risk factors for high blood pressure. So in an ideal world, we would create an app that had all of these other categories for patients to fill out and really keep track over time of things like sodium intake, potassium, alcohol consumption, because all of these things can be risk factors for them.
Also, I looked yesterday at some of these apps, and none of them looked at cross-cultural issues. Like, for example, they're not in multiple languages, you can't click, and then they don't take into account to give them sort of warning things like certain foods are bad, like you can't like eat butter and all this other stuff, or or have general kind of warning labels. So there's a kind of a disconnect still with the e-health mobile app world and the patient needs and what the doctor needs are, because even though we're trying to help them with the mobile apps, we aren't really there yet. We have just simple kind of blood pressure logs.
Right, most of the apps weren't in compliance with the ACC guidelines of telling a patient what their high blood pressure is and whether or not they're in a healthy range.
So it's also an issue. Also, the reason why they changed the guidelines is that they wanted, the American Heart Association, the American College of Cardiology, wanted to decrease the rate of stroke in America. And if people have in their minds that normal is 140/90, they might think 150/85 is good. And then that really isn't good. So to have people be aware that the cutoff is really 120/80 makes people work harder towards a goal, and that not only settle for 150/80.
And not only that, like being less than 120/80 will also help in the like there is stroke is a major complication of high blood pressure. So we have a lot of cases of stroke nowadays, and people maintaining their blood pressure less than 120/80 will help them preventing in early strokes. So in that case, the damage or the deficit will be less for the patient.
Correct, yeah. Now, the stroke guidelines are now in the American Heart Association website, and they have an acronym, FAST. So tell us about that.
Yeah, FAST is an acronym that it's posted in hospitals and things like that, so any member of the public would be able to know exactly what to do at the drop of a hat if they were in an emergency situation. So F stands for facial drooping. You want to look for that in a patient that might be having a stroke. A stands for arm or leg. You'll have weakness, numbness on one side. S is slurring of speech, so that can happen often as well. And T stands for time to call 911. So that's the acronym people can follow.
Yeah, so that's really important. So if you're at a barbecue and it's hot and it's humid and somebody collapses and you see that there's a facial droop, asymmetry of the face, and that their leg is not moving or their arm is not moving, and that they can't even speak correctly or even mumble, so then call 911, don't wait. And as an ophthalmologist, one of the things is they can also have vision problems, like they could see half the room becoming blurry and then it come back in 10 minutes as normal, and that is called a transient ischemic attack. So that's a little brain attack, and it comes back. People ignore it until it comes again and again, and it becomes permanent, and then they have the facial droop and the arm weakness, and then they have a much more severe stroke. So high blood pressure plays a role in that. And in addition, high blood pressure affects your kidneys. Tell us a little bit about that.
Yeah, high blood pressure is it affects the kidneys by, if you have a hypertensive for almost like 10 years now, and progressively the kidneys get damaged. How it happens is the kidneys actually try to filter out all the impurities from the organ patient's body. So the rate at which the kidneys filter, that actually reduces over a period of time because of the high blood pressure, and the arteries which supply the kidneys also kind of get constricted because of the high blood pressure, because you have to pump against that pressure.
So we should go back to the definition of high blood pressure.
Yeah.
So the first number, the top number, which is like 120/80, that is systolic.
Yeah.
Systolic means, tell us about that.
Yeah, systolic means is the pressure in the arteries of the major arteries in the heart. So that is the pressure on those arteries are called as the systolic blood pressure. And if you see, the heart pumps in 2 cycles. It's called the systolic cycle and the diastolic cycle. Systolic is nothing but the heart is trying to pump the blood to all the rest of the system, the entire body. And diastolic is when the heart is trying to fill for the next systolic cycle. So the pressure in the arteries when the heart is trying to fill is called as the diastolic, or the lower number, which we look for.
So the systolic pressure, if you have a high number, that means there's a pressure gradient, more resistance in going, all the blood coming from your heart, going to your brain, filling the whole cycle from the brain to the head of top to your toes, that whole cycle. So it's squishing harder and harder this blood column to go through. And in against this greater resistance, little plaques may fall off, little emboli, and that can cause strokes, can cause eye disease, can clot up your carotid arteries. And then what happens is that over time, let's say you start off as a normal human being with normal blood pressure, but you eat chocolate bonbons and eat gobs and gobs of butter and cream, and you just smother yourself in cholesterol, you get plaques, you get cholesterol laying on your arteries. And what happens is that that causes a constriction to the size of the artery, and that increases the top number, the systolic number. So then this whole cycle then goes to every organ. So you get end organ changes in the heart. So if you're constantly pressing all this blood through higher and higher, greater resistance, your heart has to pump harder. Your heart, in pumping harder, makes a bigger, fatter heart muscle, which is called hypertrophy of your left ventricle. So over time, the heart tries to get this fatter muscle in the heart to go pump, 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 and then it still can't do it. And then you get problems.
Yeah, it's called the ejection fraction, which finally reduces because you're having a huge heart muscle and it's pumping. So finally it becomes low, and that's when you end up with heart failure.
So then that's what heart failure happens, is then your heart can no longer pump, even though it's really muscular. It's like having Arnold Schwarzenegger as your heart, being a bodybuilder in your heart, but it's not efficient. And then the heart breaks down, and then you need defibrillators and heart transplants, etc. So we don't want our home audience to think about that. We want them to think, what is high blood pressure? Let's stop it at the beginning.
Yes.
There are issues with high blood pressure because sometimes the pills come in many doses, like once a day, twice a day, 3 times a day, and it's confusing. There are also different classes of compounds, so tell us.
So one class will be because of, it's called the arterial calcium channel blockers are there. Then we have diuretics. So then we have arteriolar dilators. So there are different class of medications which use, and then there are channels medications which target, the pumping of the heart, like the beta blockers, which we call. So all these medications have a different form of action, and they're all targeting high blood pressure. So sometimes the patient can be on just single medications. For instance, if they are recently diagnosed with high blood pressure, the doctor might put them on just one medication. So as a result, as time goes on, sometimes the blood pressure is not controlled with just one medication, so they need to add another medication and another medication. So there's a lot from the patient to do as well for high blood pressure is concerned. That's why we have this talk here to educate the public, general public, about how, controlling your diet, exercising regularly, all those things are also a major factor in maintaining your blood pressure.
So as an internal medicine doctor, what is your first line in somebody with simple hypertension? They're 40 years old, they have 130/80, so what do you usually?
So we usually tell that with one value we cannot define them as being hypertensive or having high blood pressure. They need to take at least 2 or 3 readings. Sometimes some patients will be very anxious when they go to a doctor, and usually they have high pressure when the doctor's office, it's called white coat hypertension. Most of the patients say that they're anxious seeing the doctor, and so the pressure is going up. So they have to check the pressure when they are at home, different settings, and if it is like 2 consecutive values or 3 consecutive values are repetitively high in different settings, and that's when you usually diagnose a patient with high blood pressure or hypertension. And initially the patient, we don't put them, sometimes if it's continuously high, then we put them on medication, but we start them with advising on their diet. We go back and ask them what their diet pattern is likely, what they eat on regular basis, and trying to modify that. And exercising regularly would be a great step for them, because it can be the weight and it can be the diet, and maybe they have a cholesterol. Sometimes they have a comorbidity called as they may be diabetic too, which being having high sugar. So these are the factors which they should consider.
Now, one of the issues about high blood pressure is that for Asians and South Asians and East Asians, there's something called a metabolic syndrome, and there are 5 risk factors. High blood pressure, high triglycerides,
Fasting blood glucose being high.
Yeah, fasting
and
glucose.
the hip circumference, the waist to hip
BMI.
circumference.
Yeah. So if 40 inches, greater than 40 inches for men, for waist,
35.
greater than 35 inches for women for waist. And so even if you have high blood pressure and it is treated, you could have one of these risk factors. And South Asians with the same numbers as a Caucasian has a 40% increased risk of stroke once they have one of these 5 factors. So it's something to think about as more people immigrate to America and more people visit America and they go to the emergency rooms. As our demographics are changing, that these are things that we should consider, that these are added things that we must consider in just high blood pressure.
And also high blood pressure is a major component of heart attacks. So we don't know how much a patient knows about heart attack and what the symptoms are about the cardiac arrest. Sometimes the patient might not know, like having chest pain, or sometimes the symptoms may be silent in diabetics. So patients might need to be aware of that.
So in that survey study, what surprised you the most? That 14% knew what it was, even though this was November 2017, the news? What else?
I think it's surprising that people are not updating themselves on the revision of blood pressure, and that's really important because they need to take the preventative measures for it before it getting worse and worse. And because once you get hypertension, you're forever hypertensive. So yeah.
Also, I think that it depends. Perhaps it's also the American Heart Association, the American College of Cardiology. They have not done enough outreach, or they feel that they've done the outreach to the primary care doctors, and then the primary care doctors are simply overwhelmed by the many millions of patients they see per year, and that they are not able to tell them that this is the latest change. And sometimes it's, as all the office medical visits have increased with the Affordable Care Act, everybody who is in primary care has experienced a lot of patients coming with diseases, and it's hard to tell them everything all at once in that first visit. And patient education is important, difficult to attain sometimes in a multicultural society where people speak many different languages. So I think that one of the other things that was important that I thought was interesting, that 100 million more people are going to be diagnosed, and that the outreach must be even more. We must try harder, or the app makers must somehow put it in their apps that, by the way, the latest guidelines are, a little banner that runs through. And we haven't reached that point in even Silicon Valley where this is being taped. So tell me what other concerns there are. Let's say I'm a 40-year-old person with hypertension 130/80, and I did not lose the weight in the next 3-month visit. I'm still chubby, and then do you start with beta blocker or what?
Depends on what they have. We do a lot of blood workup, the electrolytes, and before checking. Sometimes people can be just hypertensive on just one setting, and so we don't start them on medications immediately. So we look for their progress over a period of 3 months or 6 months and see how they go on. And if they still continue to have high blood pressure, then we might start them on a small calcium channel blocker, or sometimes a small dose of diuretic, and then see how they are. It depends, for each patient it varies, and so we don't start them on medications, all 3 medications immediately. We slowly taper and increase the dose.
So with the calcium channel blockers, what are the top 2 most common?
There are a lot of new medications which come, and sometimes the calcium channel blockers have some side effects too. Sometimes they cause edema of the feet, which is the swelling of the feet. So sometimes they don't. It's always the patient preference. We tell them what the medications are, and then sometimes the patient says, "Oh, I'm not. That medication is not good for me, so we have to change the medication."
So then many of my patients are on diuretics like hydrochlorothiazide, which is an old one. So that causes people to go to the bathroom a lot, to urinate. Some people don't like that either. So all of them come with something. So it's important to go to your pharmacist, talk to them. And if you're on many medications, you can now request your own pharmacist. And always make a list of the medications and carry it with you to every doctor so that every doctor knows. For example, as an ophthalmologist, a retina person, we realize that if you're on a beta blocker, we may not add another one. We may not add Timoptic or Timolol, which is a beta blocker for glaucoma. And we also always take pulse in our exam to make sure that if they are on a beta blocker and we add something else, we don't want to lower their systemic blood pressure and have them collapse and faint as they're putting in their glaucoma drops. So all doctors need to know the whole list. So we encourage everyone to write down the list of medicines to take to every doctor and put it, make a photocopy on your smartphone, because your smartphone acts like a Xerox machine. You can take a picture of the list of medicines, take a picture of each of the little capsules that you get from the druggist, the little pill bottle with the name. That helps all of us.
Yeah, and for high blood pressure, usually the patient can maintain their own log. They can. It's important that they buy a home machine to check that. It's available on all stores where they can buy their home blood pressure monitoring device, and they can check their blood pressure morning and evening and see, and write it down in a piece of paper before they go and see the doctor, so the doctor is aware of how the blood pressure was trending over the last 2 weeks and monitor or adjust the medications accordingly.
I've also had patients bring in their own home monitor and check it against our office, and we found that some cheap ones that are $20 don't work. So be careful. You get what you pay for. Make sure
you get a very good
a good home device, because if you get a cheap one, it's incorrect. In addition, the arm cuff has to fit correctly. If you're built like the 49ers, they have a very big bicep, you need to get a cuff that's larger. And if you're super skinny, like the beautiful Vogue models, you need to get a smaller cuff. So you have to be aware of that when you buy these home devices to check. And if they don't have that, don't buy it. Why get one that gives you the wrong reading? And then you tell your doctor, I'm fine, I'm fine. And meanwhile, you collapse, go to the ER with a stroke. So for our home audience, we should really go over certain things we think it's really important for high blood pressure. So the top number has to be less than 120, that's a systolic, and the bottom number less than 80, that's the diastolic. So look for that and ask your doctor about the latest 2017 guidelines from the American Heart Association and the American College of Cardiology. When they first came out, the New York Times had a bunch of editorials with complaints from the Academy of Family Practitioners, which they felt it was, the president of the Academy of Family Practice Practitioners felt that it was impossible to get them to that point. So I hope we've evolved, that we come to a better agreement, because obviously preventing stroke for America is very important. And the acronym for stroke is FAST. And
fast, which means you have to act fast.
Yes.
And that's an easy way to remember.
Act fast. Yeah. Phase, drooping. A for arm, tingling or not working, not moving, or leg, appendage not working. And S for slurred speech. And T, time to call 911. And the other thing for chest pain.
Yeah. They can have chest pain. Sometimes it can be just a mild pain. Sometimes it can be like spreading to the arm, and it can also go to your neck, to your tongue. Some patients can have like nausea, vomiting. Some of them can have dizziness, palpitations. All these are the, the symptoms to look for, and when you have to go to the ER immediately.
So usually it's arm pain on the left side. And if you're diabetic, you feel no pain. Yeah. So they could just have the nausea, or they can just suddenly collapse.
Some uneasiness, some just discomfort.
Yeah. So you have to be careful when you're hanging out at those summer barbecues, and it's intergenerational. So the message for our take-home audience, thank you for joining us. Remember, the top number should be less than 120, the bottom number less than 80. And don't worry, you're among the new 100 million people with new high blood pressure because of these new guidelines, because we want to help you. Thank you very much for joining us. If you like KSAR TV, please make a donation. Thank you again.